interpret an X-ray chest, I can say. Now, we have couple of lecture series which is there in our application, through which we're going to learn very easily about all the types of X-rays. Like for example, and also there are a lot of videos also on YouTube available. We can understand about how to interpret the X-rays. And this particular will be the maybe 2 or 3 lectures we're going to be conducting, which will be going to include about the way we are going to interpret a step-by-step approach for the X-ray chest. Now this is not going to, we are not going to cover any specific X-rays, but when you look at the X-ray, how exactly we are supposed to interpret, what are the things you're going to be looking at the X-ray, so that we are not going to miss anything. Because many times what happens, if you are looking at an X-ray, you find some pathology, let's say, and immediately that you jump to the diagnosis कि ये हो सकता है. But there is a possibility that patient can have maybe 2 or 3 pathologies in the same X-ray. If the patient's age is more than 60 years old, patient has got old history of tuberculosis, or maybe congestive heart failure, or maybe any chest pathology. Let's say for example a patient is a case of COPD. So there are a lot of pathological findings which may be there in the X-ray, which may not be important right now, which may not be relevant right now. So if you go through this step-by-step approach, we are going to understand about how exactly we are going to interpret step-by-step approach. Those who are expert, let's say for example in the X-rays, indirectly follow these guidelines. Why I'm not saying directly, because they can interpret the X-ray in a flash of second. Okay, this is what is the diagnosis. Let's say for example somebody is a radiologist, interpret it in a flash of second. But in the expert's mind, what is going to happen is he indirectly follows all these steps. Let's say for example, when you are learning to ride or drive a car, let's say for example, initially you cannot tolerate any disturbance, because your mind is too much busy interpreting lot of things कि मेरी गाड़ी कितने स्पीड से जा रही है, बाजू से कौन आ रहा है, ट्रैफिक सिग्नल क्या है, what exactly is the speed of the car right now, how far the car is going to go if this particular speed is there, where exactly is the gear right now. Lekin when you become expert, all these calculations are done quickly, indirectly, at back of your mind. So to become expert in the X-ray, you will have to understand that the expert mentality comes only after interpreting hundreds of X-rays. So before we go into anything, let's first understand the schematic approach. What exactly are the things we're going to be looking at the X-ray? Let's say for example, what are the structures we're going to look at? And here we're going to understand all those structures में हम लोग step by step कैसे जाए. Let's say for example, so first important thing